of the working group. We've been, but it is being recorded. And let me click continue here. But it is being recorded tonight, so people will have the benefit of seeing that. And but we do want to invite the public and include the public, and so we'll be having comments from folks at the end of the meeting. And with that, I think we'll go ahead and get started with our presentation.
Tom, we're going to do a quick just roll call.
Okay.
How about Hannah, do you want to lead that, or do you want me to read off the names I see on our panelist list? And if we don't get one, you can call them, or do you want to just read them off?
I can just run through a list if that's okay.
Okay.
Quicker.
Okay.
Craig Cadwallader.
I'm here, thanks.
Cambria Vent.
Hey, sure. Yeah. Does it have a volume control?
Cindy Shaven.
Here.
Thank you. Sue Eller. Jan.
Here.
Thank you. John LaRock. Patrick Flannery. Jean Lucio. Pat Dreisler. George Schmelzer. I think I see his name down here.
Yep.
Okay. Pat Ost. I see his name as well. Jim Light. I see.
Here.
Yeah, thank you, Jim. Walter Dower. Mark Nelson. Dempsey Nelson.
Here.
Justin Pioletti. Joanne Sturgis.
Here.
Laurie Glover. Jacqueline Folkert. Bruce Steele.
Here.
Pete Ohakis. Jeff Gilbert.
Here.
Roseanne Taylor.
Here.
And Lisa Nichols. Thank you.
Okay, well, thank you again, everybody, for joining us. Kristen, anything else, or should we go ahead and get started?
No, that's it. I think Rick is representing the Homeowners Association on the corner of Flagler and Borough.
Correct.
Okay, great.
Yeah. Replace Pete.
Great.
Replace
Welcome,
Pete.
Rick.
Thank you.
Yeah, glad you're here. So just a quick agenda for tonight. We want to talk a little bit about where we've been. Some of you have been with us for over 3 years, and we appreciate that. And so we're going to talk briefly about where we've been. We are going to talk about the refined master plan concept that was put out on Friday, and you all received copies of that, and we'll go over that. The architects are here tonight to answer questions about that, and then we'll have questions from the working group, and then any questions from community members. So that's going to be the agenda tonight. It's information and input session. There are no decisions tonight, but we do want to get your input, and then we'll be passing that along to the board for their meeting on Wednesday. And that will also be put online.
I thought they're taking it from the public.
No.
They said they are.
Well, they did, but in the thing, they said no.
So we can't get in?
So I don't know whose line that is, but we'll just need to, if you guys can mute. So just so we're clear about input tonight, this is not a Brown Act meeting, but we are going to be taking input from the public at the end of the meeting.
Hey, Tom, it's the 6452 number. They said we're muted, so I don't think they realize that they're actually not muted.
Okay. So there, just so everybody knows, at the bottom of your screen, if you take your cursor down there, you'll see a little microphone, and if you click on that, that'll mute you, and then when you'd like to speak, you can unmute that. So just real quick overview. I think everybody's familiar with where the campus is. This is a view of the campus, kind of looking from above towards the top of the screen there is Prospect. It's the building and campus is on 11 acres there at Prospect and Barrel and along Flagler. Many of you know that the building's been there for 60 years. It was built as a hospital originally. It currently does not meet seismic standards and does not meet the tenant needs. It's a 60-year-old building that has served the community well, but we began this effort to address the seismic issues of this building as well as to re-envision the campus. And we started that in earnest 3 years ago, but really started back in as far back as 2009 when we looked at different things that could occur on this campus. So we've been discussing the campus for a while, but the recent efforts have really sort of picked up in earnest here with this working group for the last 3 years since 2017. One of the things that we've talked about is that we have about a 1 to 3 year window to really look at what's happening on this campus due to escalating building maintenance costs and what we're seeing as far as our financial projections. And so we'll show you a few financial slides. The financial discussion is really going to take place tomorrow night at the Finance Committee. All of that's been published online and is available to the public. And so we're happy to answer any financial questions that you might have tonight, but we do have about a 1 to 3 year window before the expenses from this 60-year-old building that doesn't meet seismic standards start to exceed the revenues that we receive from it. And then that impacts our programs. I think as everybody knows, we're a public agency. We have a publicly elected board from the 3 beach cities of Hermosa, Manhattan, and Redondo. And so any revenue that we receive from this campus goes back into the programs that we provide as a public agency. And so there's no profit from this campus. Any excess revenue above expenses, that basic for this campus goes to provide the services of the health district. Next slide. So I want to talk a little bit about why the project matters. Why are we doing this? I think some people are wondering that. Major reason is seismic safety issues. When we did our emergency planning about 6 months ago, we identified our risks as, what would you guess the risks would be? It was seismic issues, it was a pandemic, and it was a cyber attack. And I think 6 months ago, listening to that, we all said, yep, and I think those things maybe can happen. And well, one obviously has happened, and we have a very clear seismic safety issue at the current building. And so we'll talk a little bit about that tonight and review some of the slides that this group has seen before. We'll show that briefly. The other thing that we wanted to do and why this project matters is we wanted to establish a center of excellence for community health. This wasn't something that we just dreamed up in 2018. We went out to the public, did a series of study circles that many of you participated in. And one of the things that we clearly heard there is there needs to be a place where we can have our center of excellence programs, whether it's what we've done with childhood obesity, what we've done with the blue zones. You see the Surgeon General there in the upper left-hand corner, or what we've done with the school districts or our partnerships with the cities, or what we're doing with cognitive health. We need a place to establish a center of excellence for community health. So that was another reason for looking at the campus. The other thing that I talked about briefly is that we do use revenue from the campus to fund our public programs. And so this is just a quick snapshot of the types of programs we have. We have 40+ programs, and revenue from the campus assists with that. And with that building going away due to seismic issues, we need to address that revenue in order to provide our programs at the same level of service. So you all assisted in the beginning with establishing these pillars. So these are the policy pillars that the board has approved. And this is what really sort of drives a lot of the decisions around what happens with the campus. And so this was the overall sort of objectives or policy pillars for the campus that were established, boy, well over 2 years ago, probably 2.5 years ago. It was one of the first things that this group looked at when it first started. This is the vision that we've identified for the campus. Maybe I will read this. The Healthy Living Campus Project is a unique opportunity for our community to chart the future of health by purposefully building an intergenerational, vibrant, research-driven campus where people can learn and engage in healthy behaviors, form meaningful connections, and be well for many generations to come. So that was the vision of what we were looking to accomplish with the Healthy Living Campus Project. And so I'd like to have Ed Almanza talk a little bit about the environmental impact report process. Some of you maybe that are not on the working group, maybe were first introduced a little over a year or so ago to this project when we began the EIR scoping process. And I just wanted Ed to just kind of walk us through what's happened and where we are in the development process.
So this slide, I think this is a part 2 slide. There's another one with more steps. But this shows some of the standard steps in a project development process. And so as you can see, it starts with just identifying the need for the project, which Tom described, and then defining the programmatic needs and a preliminary master plan. We've been through all these steps, and up to now we've been down around 8. In fact, 8, which is where we conducted the EIR scoping process and started to do the EIR, just got into the existing conditions. That's kind of where we've been for a while. In fact, I'd say we've been at 8.5, sort of like a prolonged Fellini moment for a long time, waiting for 9. And then 9 is what's happened in the last few months, where the plans have been adjusted in response to opportunities and constraints. And now we have a refined master plan. So that takes us to where we are actually today, which is 10. And this is very exciting for me because we're right at the starting gate for the EIR. I think that's where we want to be. We've gone through a couple loops where the site plan's been revised. If you think about what number 9 does, it looks a lot like number 5. So we've gone back and done a couple different steps of refining the master plan. But now it's time to go on with the EIR. So we're eager to do that. And I think it's time to hone in on finding out what the impacts are instead of just sort of wondering what they might be. This is where we finally get to address those issues that the public and the agencies identified during the scoping process and understand what the impacts of the project really are so the decision makers can make an informed decision when it's before them in a few months. So that's our overall process. Up through the EIR, I think we're well positioned to begin. I'm pleased with the site plan now and look forward to starting that work.
Ed, should I take us through the project objectives?
The project objectives reflect all the things that Tom has just talked about, the mission and the vision and the pillars and the principles. But the project objectives for the EIR have a specific use, and that is they're meant to really hone in on those things that are essential to the project and its purpose. And they are used to gauge the effectiveness in any alternatives that are proposed in the EIR and the effect of those alternatives on achieving these objectives. So there's a lot of thought has gone into this. It's mostly derived from the pillars and principles and vision, but they're carefully stated so that they don't set us up in a way that we're wedded to a particular feature of the project that isn't specific to what the real purpose is. I gave the example in one of the EIR workshops that we did of a project where it had an objective where it defined the need for a 90-foot steeple. The project was a church. And so it was difficult to pry away that feature of the project from any alternatives, and that hampered the EIR process. We want objectives like these They're articulate about the basic needs and reasons for the project, and they reflect the vision and the pillars that have been developed by this group and the board up to this point. So this will be in the EIR. You'll see this in the project description.
So this is a presentation that the working group has seen. We did bring in the engineers to talk about the seismic issues that we have with the 514 building. And so they've pointed out the issues that they have seen in their assessment. And you can see that there from the pictures, and why they have come to the conclusion that the building does not meet current standards and would have issues during an earthquake. And so this is just a quick sort of review of what they looked at, what they saw, and the assessment that they made as far as the seismic upgrade. And so you're seeing that it would be extensive for the north and south towers. One of the things that we're talking about at the Finance Committee meeting tomorrow night, again, all of this information is public and online. We did go in and do a financial assessment of that and look at what a seismic upgrade would cost and how we would finance that. And so that is something that's being discussed at the Finance Committee tomorrow night. But we wanted to just remind everybody about the seismic issues related to the hospital building. So some of the constraints that we saw when we were looking at sort of where we are now, as Ed mentioned, kind of in that process of looking at opportunities and constraints. You know, one of the things that when you see the site plan, that building to the south there on Prospect, the 510 building, currently is under lease by the developer for another 10 years. And so many will recall that that part of the plan is phase 3 of the plan. And so the reason why it was phase 3 and why it was a 15-year plan is because we didn't have control over that property for another 10 years. That lease is not up until 2030 at the 510 building. We had thought that there might be an opportunity to end that lease sooner and be able to reduce some of the construction impacts, or at least the time that some of the community has expressed concern about, and we are unable to end that lease prior to 510. Prior to 2030. We've talked about the seismic issues. We've also done phase 1 and 2 environmental work on the property, and we have seen from an adjacent property owner that there is a chemical called PCE, typical from a dry cleaning business from an adjacent property. We are seeing that on the property, and so that's making us want to do this project even more. We want to clean that up that is on our property. We are talking with the water board about that, and we've begun the process with them. So that's another sort of issue that we're seeing. We heard loud and clear, and I think hopefully one of the take-home messages, and people will hopefully see that we're walking our talk, is that we are listening. And one of the things that we've been hearing clearly was the amount of construction time. And so that was a constraint that we started to consider. We were hearing concerns about project impacts on Barrel and Flagler and the neighborhood in Torrance. And so we were hearing that. And then one of the things that I think we're struggling with a little bit is, and as a community, and it's really going to get into this discussion that we have tonight about trade-offs, is in some cases, sometimes people want to spread out development. That would be sprawl. There's certain benefits to that, certain advantages to that. And sometimes you want to maybe make things a little more dense, where maybe you have some more open space if you do that, or less impacts. And so I think when we show you our original drawing we had in 2017, which was very dense, then we went with one that was a little maybe too spread out. And so now And so that was what we were hearing, and hopefully we have something that works a little better. And just looking at the long-term financial outlook, you can see in the green line there what we're projecting, and this is where we're saying we got that 1 to 3 year window roughly, where you can see where we are 2019 with the green line, and you can see that green line then starts to drop here in the next couple of years. And so obviously what's happening there is that's showing that the expenses from that building are starting to exceed the revenue. And so this is obviously the downward trend. When we look at our operating income, and again, this will be discussed in detail at the Finance Committee tomorrow night, but when we look at the potential operating income, and we've used the financial advisor firm of Kane Brothers to assist us with this, when we look at operating income for just phase 1 and a program called PACE, we'll talk both about those here in a moment. You can see how we need to spend some funds initially, but then we get our sort of revenues back on track, and we replace the revenues that we have today at the building over time. And so what that means for our fund balance is we do have a fund balance. You know, we haven't been shy about that. This is the community's money. This is money that we have in a capital account. And basically it was put in there to address the issue of this building. And so you can see with the green line, if you don't address what's happening with that negative net income, that in the green line, basically your reserve drops. With the blue line, you have that expenditure of capital initially, and then you come back up and you have basically replaced that revenue that the building is generating today. So that goes back to the objectives we just looked at, where you saw the second objective there was to try to, and its first objective was seismic. Second was replace the funds that the building is generating today to fund our public programs. And so we're going to get into the details of this tomorrow night, but we have looked at phase 1, which we'll show you here in a moment, and our financial advisor is showing that is financially feasible. So what's new, what's happening? Let's get to the plans. One of the things that we have been talking about in the South Bay for a long time is the issue of pools and aquatics. As most people know from the original master plan, there was an aquatics component. It was rather small. It was a warm water therapy pool. So what you'll see in these plans that we would like to move through the EIR process on is a pool. This would be a community pool, and a pool that would be available to the community on the campus. That would be in phase 2. One of the things that we've been doing that's come to light, of course, with COVID here lately is looking at innovation. We have done started an innovation study. We're maybe a third or to a half a way through that study. The first phase of that study is available online. That's been done with SG2, where they're looking at, okay, what's the future for the district? What do things look like as far as virtual medicine or telemedicine, which just moved up the timeline here in the last 4 months. They came back and said, hey, you know, be careful giving up all of that medical office building. That's something that we think you may need to keep in the future. Opportunity that we have by doing this type of financing is that we would have 25% ownership of the piece related to the residential care for the elderly. Again, we'll get into detail with this tomorrow night. That would not mean that we would be giving up control, and we've heard loud and clear from the community to retain the control even if our ownership is 25%. One thing that this group has talked about is what about below market rates? And so within the financial analysis that is showing that phase 1 is feasible, we're seeing that we have 10% below market rates, and so that would be 16 units. So when we talk about the number of units, and we'll get into that in a moment here, but we have 160 assisted living units plus the 60 that we already have at Silverado, for a total of 220 now, down from the 420, and we'll show you how that all lays out on the site. But when we talk about below market rates, we're talking about for 10% of the 160 assisted living units, which would be 16 units. One of the things that is new, and Carrie Ann's going to talk a little bit about it, is PACE program. What that is, it's a program for all-inclusive care for the elderly. It's something that was started in San Francisco, and a program that's worked very well, and we think there's an opportunity for that to have a place here on the campus. Usable open space, that's an opportunity that we want to continue to pursue. And then one thing that we want to be clear when we're looking at the drawings is regarding Flagler. Flagler access now, and any access into the campus off of Flagler would be for drop-off and service vehicles only. There would not be people that would be turning onto Flagler to come to the Center for Health and Fitness. That entrance has been changed. And so the only access or drop-off happening off of Barrel would be drop-off for PACE, drop-off for assisted living, and then service vehicles. And then we are proposing to close the street at Towers, and that is something that we would be proposing as part of our project. As many of you that live in that area know, there's a current traffic problem there with people using the back entrance of the school and driving through the neighborhood and then exiting out Flagler or coming in from Flagler rather than waiting on Barrel to get to the Torrance School. Under our project, we would be proposing to close Flagler at Towers if that was something that the neighborhood wanted. I'm understanding that preliminarily that may be of interest to the neighborhood, but that's something that we would be proposing to do as part of our project. So when we don't want to lose that vision statement that we had before of creating this place where people can come to be well. So again, these are some of the things that would be happening within the Wellness Pavilion in phase 2. And this is something that we've been over before. You see the demonstration kitchen there. You see the programmed open space there. And so these would all be activities that we would be hoping would be occurring on campus, and then it would be an intergenerational campus. So Carrie Ann's going to talk a little bit about a continuum of care approach, and this is obviously on everybody's mind with COVID-19, and we want to make sure that we're being responsive, obviously, to what's happening in the world right now, and taking the best advice and counsel possible as it relates to COVID-19. And so we did want to talk a little bit about that. So Carrie Ann, could you do this part?
Sure. So I'm actually going to start on the right-hand side of this slide with community services. As many of you on the working group know, we already provide services to residents of Redondo, Hermosa, and Manhattan Beach, really targeted at helping them stay independent in their own homes. So we have master's level social workers who go out to the home. Well, pre-COVID-19, they went out to the home. We're not yet resuming home visits with our vulnerable populations, but we do really all-inclusive assessments. In social work, we call it a biopsychosocial. I used to tell people it meant we asked all manner of impertinent questions. So we talk about health conditions, we talk about social activities, we talk about their psychological health, their medications, and we help families create a care plan. Oftentimes in our experience, an older adult's trajectory is a continuum, and that plan needs to be updated over time. And families need lots of options. There really is no one-size-fit-all approach to providing this kind of care for a loved one, and it's a very complicated system. And so what we're trying to do with the Health Living Campus is really bring more choices into that continuum for our community. So with the PACE clinic, the program for all-inclusive care for the elderly, it provides medical and social services to older adults, 55 and older, specifically targeting folks who are on a trajectory to need skilled nursing placement. And so really trying to help them either remain in their home or in a community-based home-like setting in a residential care facility to keep them out of skilled nursing. When we talk about residential care for the elderly, that's a licensing category in the state of California that covers a bunch of different types of facilities. We're talking about assisted living, which is a lower level of care. And really, individuals generally enter into assisted living when they need care with a few things, maybe two of their activities of daily living. Maybe they need help with bathing and with cooking. Maybe they need help with dressing. And then they can stay in that facility in a more apartment-like setting as their needs change over time. Memory care is very similar to assisted living, but they provide specialized care for folks who are having memory impairment. So whether it's because of Alzheimer's disease or some other type of dementia, there is a bit of special training and some other considerations for providing quality care for that section of the population. Skilled nursing has been a lot in the news through the COVID-19 crisis because unfortunately, many of our older adults who are passing away from COVID-19 are in skilled nursing. I think it's important to understand that a skilled nursing population oftentimes is comprised of two separate groups. One are folks who are there off of a hospital discharge and they're there for rehab. They're there to do physical therapy, to get stronger. They may have a plan to go home, but they need this short stay that is often paid for by Medicare up to 120 days to get strong enough to transition to a different environment. And then there are some folks who need such a high level of nursing care or in the United States have outlived their money and require Medicaid, Medi-Cal in California, Medicaid nationwide, to pay for their care. And the only choice is skilled nursing. Skilled nursing is a very hospital-like setting. You do not have private rooms generally. It's more 2 or 3 to a room. There isn't the opportunity to bring your own furniture and make it home-like. And in that environment, as we've seen in the COVID-19 crisis, it's very difficult to do infection control without that sense of privacy and those individual apartment-like settings. And so the other thing I think is interesting, just watching the county data that they've put out every day since the beginning of this crisis, when you look at the crisis in the facilities, it is possible to control COVID-19. There are numerous facilities who had maybe 1 case, 2 cases, a handful of cases, and then got control of it. And then on the other side of the spectrum are facilities that just had incredibly large outbreaks, but there isn't much in the middle. It's either they were able to do the infection control or they were not. And so I think we're learning a lot about wanting to have a home-like setting that involves more apartment style living to afford more privacy, more choice, more opportunity to make it individual and your own by bringing in your own furniture and decor, but also to really aid in the necessary infection control that we're just not seeing in skilled nursing. So I'd be happy when we get to discussions to answer any other questions or talk about the data.
Okay, so we're going to now get in and actually look at the master plan. I'm going to move pretty quickly through this. This is the 2017 initial plan. Many of you were here for this. You can see Barry Dins contemplates having the hospital there. You can see some of the things that we heard about it. This is when we pulled back and did the work with the study circles. Took a year, 2018, to work on that. So that's the initial site plan from 2017. This is the master plan that we started the EIR process with. You can see more open space there, but we had heard concerns about the amount of units, concerns about impacts to the neighbors. The long construction time of 15 years was of concern. And then we also heard concerns about impacts again on Beryl and Flagler, and then questions about, will this really be of a benefit to the community? So what we wanted to do is just show the trade-offs associated with the 3 plans that we have. So you have the existing campus, you have the number of residential care for the elderly. So as Carrie Ann just described, we have the 60 units for memory care. Under the master plan, we had a total of 420 or 360 net new RF residential care for the elderly units. What we're proposing in the refined plan is 160 new for a total of 220. And so you can see the occupied square footage there of the 2019 master plan, including the two office buildings up front, the 510 and the 520 building, was 592,700 square feet. It comes down to 484 square feet when you include 510 and 520. But when you just look at the RCFE, residential care for the elderly, it's coming down from the 2019 master plan from 423,000 to 253,700. And the big reason why that's occurring is that we're no longer proposing a phase 3. We're proposing to keep the 510 building in that area as medical office building. And so that reduces the active construction time. With the 3 phases, it was 9 years of active construction for all 3 phases. Because there are 2 phases, we're looking at 4 years of active construction. So basically, have almost cut the number of units in half from the original master plan and reduced the construction time by roughly in half. It depends, and we'll show you here in a moment about the second phase. So one of the things that we did, there's no longer phase 2. There's no longer phase 2 of residential care for the elderly along the eastern side of the property. We did put that over in phase 1. And so we have suggested, and we heard this from some in the community, that maybe the density should be located behind the shopping center there where it's not adjacent to residents. And so we've done that in phase 1. And so the number of stories in phase 1, there are 6 stories there. So those are some of the trade-offs, where lower construction time, but slightly higher buildings, at least in phase 1, but tucked behind the commercial property. We did see the open space decrease a little bit from, well, right now it's about 0. Went up to 3.6 acres as part of the master plan. This is, again, active open space. And so it's around close to 2.5 acres now. That's in large part due to the aquatics and the pool that would be going in. And then, of course, the cost has come down because we're not doing the phase 3. And again, the costs and finances will be discussed in detail. So I think when we consider what's happening, it's important to not just sort of cherry pick one of these, like height, for instance, and say, wow, it's getting taller, right? But the construction time is going down. The location of the density has changed, where there's no longer an access for general traffic on Flagler. And so we would encourage people, when they're maybe posting or showing what's happening with the project, that we tell the whole picture of all the trade-offs, because that's going to be a big part of the EIR discussion. Okay, so I think Paul's going to now take us through the drawings and make sure everybody understands what's happening. And we have included in this presentation that we've sent out to you, we've included elevations as well as 3D drawings in addition to what we posted Friday with the site plan. So Paul, you want to walk us through it?
Sure, thanks, Tom. This is an overview of the proposed master plan as we have it now. It's a 2-phase plan, and in the orange brown you can see phase 1, which limits the new building development to, as Tom has mentioned, the side of the site that overlooks the shopping center, as well as into the Flagler lot. And then phase 2, well, phase 1 would include all of the housing. It would include the PACE facility, community services for the district that's currently in the hospital building now, some back of house services, and It would include some surface parking as well as the open space that you see in gray, with some walking and bike paths and whatnot. So that's where this phase one is limited to, as opposed to the whole perimeter. Phase two would construct the wellness pavilion, kind of a combined building, which would include the wellness pavilion with various district services and offices. It would include the aquatics facility on the ground floor, and then the Center for Health and Fitness above that. And then to the right of that rectangle would be a new above grade parking, mostly above grade parking, some below grade levels. And that parking would replace the existing parking facility behind 510. So it would serve both the 510 MOB as well as the new phase two parking needs and the housing parking needs. So this is the 2019 master plan, as you may recall. You see kind of starting in the upper left, we had the Child Development Center down on the Flagler lot. And then we had 2 levels of subterranean parking that followed the perimeter building below grade. And there were several entrances and exits for that, but a primary entrance for that was off of Flagler. And again, as Tom has mentioned, we've since eliminated that for general parking. We had a phase one in the northwest part of the property that overlooks the shopping center. We had a phase two that added housing to that along the eastern side of the property. And then the phase three expanded once the 510 and its parking structure were taken down. We put in new additional housing and above grade parking, as well as the wellness pavilion, which was kind of the centerpiece among the 3 to 4 acres of active open space that the perimeter building kind of embraced. Okay. Go ahead.
This is yep, go ahead, Paul.
Okay, so this is the phase one plan for our new master plan. At the Flagler lot, again, starting in the upper left, we have a drop off for assisted living entrance. And then in the gray, just behind that, just below that blue area, we have a service entrance off of Flagler so that the loading and the service facilities are below grade there. Above that, on the next plan to the right, at the main campus level, would be assisted living, the community services that are currently located in the hospital for the district, a small entrance for memory care above in pink, and then the PACE facility at the Flagler lot on this level. Above that is all the housing. It's memory care on 2 floors and assisted living. It goes all the way up to the 6th floor. Phase two, as we saw, would add the combined aquatics, CHF, and then wellness pavilion above in a combined building. And then to the lower right of that would be the parking garage that would serve the whole campus, as well as the 510 MOB. The open space, again, kind of cradled between the phase two buildings And the phase 1 buildings, roughly 2.5 acres of active open space available. So this is just some very general 3-dimensional massing views, not very detailed with, you know, windows or anything like that, but just kind of giving you an idea of how big the building is and how it relates to the site. As you may recall, that this was a 4-story scheme. Part of the ground floor at the campus level was open with breezeways to allow views from the open space. And by being able to use the entire perimeter, we were able to keep the building relatively low. As we go to the current plan, and we're focusing the development on the northwest side, we go higher while we're accommodating less units. We still need to go higher to get the number of units to make it financially feasible. So that's the concentrated building there on that one side, in blue and pink, and then the PACE is in the tan at the Flagler lot. And then on the, between the MOB buildings is a surface parking lot, which is that light gray rectangle. And that would be temporary surface parking for the housing before phase 2 is developed. In phase 2, this is the combined building that's stepped down towards the open space. We're showing the aquatics level on the ground floor in blue, the fitness center in green above that, and then in the somewhat orange color is the wellness pavilion facilities above that. And then next to it is the parking structure in light gray. In terms of building heights, this is the 2019 master plan. You can see in the red line, the red horizontal line, that is the top of the existing penthouse at the hospital. So that's the high point of the hospital buildings that are existing. So this shows, you know, the kind of breezeway below the housing in blue. And then, so that's the main campus level. And then 3 levels of housing above that that really follow the perimeter of the site. You can see the parking in light gray is below grade. And of course, the wellness pavilion is the center building in the open space. In the new proposal, we're going up to a height that corresponds to the high point of the penthouse existing in the hospital. And you can see the 6 stories here, again, represented in blue and pink, different cuts through the building. In the second row up on the left, you can see the subterranean surface services in the gray that would be accessed below that, the drawing below that to the left. Yeah, that's the service area for loading and services. It's the garage access from Flagler, and then assisted living with a drop off to the right of that off of Barrel. The PACE facility is above that. It forms a kind of a porte cochere and entrance for the assisted living down at the Flagler lot elevation. And then that could be accessed from there or from the main campus level up at the higher elevation. For phase 2, we're maintaining we're not exceeding the height of phase 1. Again, the red lines are indicating the existing penthouses at the high point of the hospital, and the new combined wellness pavilion, fitness center, and aquatic center would be below that, below the height of the housing. And then the parking structure would be at the same height of the wellness pavilion, fitness center, aquatics building. There would likely be some penthouses for elevator and stairs for roof access, but otherwise the height you're seeing here would be the main roof line for the new buildings.
So that's a quick overview. I guess just one thing, Kristen, if we could just go back a moment to, I guess it would be the phase 1 3D. I just want to make sure everybody kind of understands this one here. So this is the phase 1 plan that we're proposing and want to get your input on tonight. The phase 2, this one, we have shown that it is financially feasible to do this phase. As we've been talking about since last March, phase 2 we would need to raise additional funds in order to do that, either through some sort of capital campaign or use of other funds. The other thing that happens here is that the Center for Health and Fitness would move off campus temporarily and then would come back in phase 2. But if for whatever reason we never did phase 2, this would be what the campus would look like. You would still have the Center for Health and Fitness off campus, but this is what the campus would look like. And when you compare this to the objectives that we had previously, it gets you about 4 out of 6 objectives. And then if you come in with phase 2, it helps you to accomplish the other objectives. And that's something that we'd be looking at in the EIR process. Okay, so Kristen, maybe just talk timing a little bit, and then we want to get comments. So I think everybody knows, because many of you have been here for the last 3 years, this is where we've come from since May of 2017. This is where we are right now in the green, as presenting the refined master plan. Just want to be real clear that we're not asking for any sort of approvals from you or the board. We're simply saying, based upon the EIR process that's been going on for a year here, we're recommending that we refine the master plan, that we reduce its scope, as has been described here tonight. We use this as the project description, and then we move forward with the EIR process with that revised and reduced scope of the master plan. So that's what we're recommending. You know, we've heard comments about people needing to kick the tires. I think the EIR process is the perfect place to kick the tires. We started that with the master plan, but based upon what we've heard, we're recommending to go ahead and reduce the size and scope and proceed with the EIR process. And we'll talk, I think the next slide talks a little bit about the timing of that. And so that's where we are right now, is in the green there, the EIR preparation. We'd be looking at, let's see, I think that needs to be updated. That slide does. We would be looking at, let me just get my, as far as next steps, we would see that a draft EIR would be released in the fall of 2020. So that needs to be updated, Kristen. And that we would then look for a finalized EIR in the spring of 2021. And then you can see in the staff report that's online that we would be, looking to, if everything, depending on what happens with the EIR, depending upon what happens with conditional use permits, that construction would perhaps start summer of 2022. So we're 2 years away from that, depending on what happens with the EIR and the conditional use permit of phase 1. So I just want to be real clear that we're not making decisions tonight. It all has to, or this week or in July or August. We're just basically suggesting that the scope of the EIR be reduced and that project description be used for the EIR process. So just in summary, as far as what's changed from the 2019 master plan, the buildings have been repositioned. There's fewer, smaller, and less. There's fewer units. There's smaller square footage, less construction time, no through traffic on Flagler, service and limited drop-off only. In phase one, you do not have the Center for Health and Fitness, so you do not have that traffic there. New programs and things that are new in what this refined master plan looks at are aquatics, enhanced aquatics, something this community's talked about for a long time, and we'd like to take that to the next level by including it in the EIR process, and then the PACE program. And so the recommendation that we're going to be making to the board, they could take action Wednesday, whether they take action this week or in July or August, whenever they take action, it would be to basically consider the refined master plan as the basis of the project description for the EIR, and then to go ahead and prepare the draft EIR. So again, they're not approving the project. They would simply be considering the revised master plan as the basis for the project description to move forward with the EIR and the public process and all the comments and public involvement that we would have as part of that. So that's where we are. I wanted to give the working group opportunity to ask questions or give comments and have a dialogue about what you've seen tonight.
Tom, this is Jan Buick from Manhattan Beach, and I just have to compliment BCHD on the thoroughness of how you have really not only listened to all the constituencies, but like taken into account what they're saying and address those concerns while maintaining the integrity of what people wanted to. So I just really compliment BCHD on that.
Thank you. I think we'll keep sharing the screen in case we got to go back to any drawings, but then at some point we'll probably want to stop sharing the screen so we can have a little more of a dialogue, even virtually, but we'll keep it up for a little bit as people have questions.
And I see Jeff raised his hand, so if you want to go next.
Yeah, can you hear me?
Yes.
Okay. Yeah, can you give a little bit more information about what the aquatic center is? Does it have a community swimming pool? How big is it? Information like that.
I muted myself. So the square footage of the aquatics is 24,000 square feet. And the square footage for the Center for Health and Fitness, help me, Paul or Leslie, is it around 20,000?
That's right.
So it's larger than the Center for Health and Fitness, and so the concept would be that it would be a community pool. There, we haven't framed up exactly whether it be a lap pool or whether there would be some sort of leisure pool element. Those would all be things that would need to be looked at. But at 24,000 square feet, it would be a community-sized pool.
Because an Olympic swimming pool is roughly 13,400 square feet. So I don't know if that was the size you were thinking about putting in.
No, I think the idea was to really have the community have that discussion and whether it's an Olympic pool or whether there would be warm water therapy pool or whether there would also be some sort of leisure opportunity, you know, like a kid's pool with slides and that sort of thing. Those would all be things that would need to be looked at, and the community would need to decide which elements it would like there. But at 24,000 square feet, it would be a good sized pool.
Okay. The other question I had was the parking structure. In the preparation material I got on the 12th, it shows that the parking structure that'll be built in phase 2 is going to be quite a bit taller than the parking structure we have now. I think it's a total of 8 stories, counting the basement, and then parking on the roof. So how much taller compared to the present parking structure, not the penthouse, which I can't see, but how will the parking structure that we have now relate to the height of the parking structure that I see every day?
Yeah, Paul, I don't know if you have a...
Well, I think if we go to maybe the master plan, the 2019 master plan. No, actually, that's not going to work. Let's go to the phase 1 3D drawing. Okay, phase 1. So you see the existing parking structure there, which is roughly 3 stories, 2 to 3 stories. The new structure on the next slide, as you say, is going to be quite a bit higher. It's got a kind of a reduced side facing the property line in terms of width, but it is higher. Part of it's below grade, most of it's above grade. And one of the things that we've been struggling with in these studies is just the benefits of subterranean parking versus the costs. It's quite a bit less money to build an above grade parking structure. Here we've put a couple stories below grade and the rest of it has to be above. I mean, I think I'm not sure how many feet higher, but than the existing, but it's at least 5 stories higher. Parking stories, which are lower stories than the building.
So it's 5 stories higher than the present building?
Yeah, parking stories, yeah.
Right. I mean, compared to the present parking structure, the new one will be 5 stories higher.
No.
Oh, that's very, very high.
But you hear, Jeff, the distinction he's making, that parking stories are not normal height of stories. And again, these would be the types of things that the EIR would be looking at. But as Paul mentioned, you see the smaller side there. So we structured it in such a way that it would hopefully have less impact on the neighbors there. So based upon you can see the shape of the facility, and then setting it back from the hillside there. Again, those would all be things that would be looked at as part of the EIR process. And we'd love to build less parking. I mean, right now this is what's required, by the city of Redondo Beach for the type of use that we would have with the pool, mainly the pool and the Center for Health and Fitness. So if things move forward with the general plan and less parking is allowed, we would love to build less parking, of course.
Well, again, excuse me though, I think Paul had indicated that there's a possibility that you would not put the swimming pool and the fitness center there. That would not be part. You'd eliminate basically phase 2 and just leave everything the way it is after completing phase 1. That's still an option?
Well, that was me talking. So we're going to be recommending that we move forward with this as part of the EIR, where there would be a phase 2. But if the funds were not raised to build phase 2, then you would not have the new parking structure, nor the pool or the wellness pavilion.
Right. Well, I do appreciate the fact that the parking structure floors are shorter, but we're still looking at a parking structure that's going to be, 150% higher than the building that I have right now.
And so obviously the concerns would be sight lines and shadowing those types of things, and those would be looked at as part of the EIR process.
I see, okay.
Yeah, I would say, Tom, this is Ed, that the question that Jeff posed and exactly the terms that he used are what the EIR would address, because he's speaking to the difference between proposed over existing, and that's what the EIR will do. And it would also consider what Paul's talking about, which is the trade-offs which are at play. So there will be a discussion of potential alternatives. The advantage of the EIR is that we will have a better sense of the actual impacts. And as I've said in our workshops and probably every opportunity I can get, the EIR is a problem-solving document. So it's really goal-driven in that it's not just trying to address impacts, it's trying to bring them below a level of significance based on the thresholds that are described in the EIR. So we think we have more tools to really solve the problem in the EIR environment, and we could be able to describe what we mean by eliminating or avoiding significant impacts. That's one of the reasons we're eager to get to work on this, so we can address those kinds of issues.
Other questions or comments from the working group?
Yep. Bruce?
Hi, Bruce.
Hello?
Yeah,
Can
we
I
can
go?
hear you. Yeah, we can hear you.
Okay.
Yep.
Yeah, just to follow up on what's been said, I think that probably for Torrance, the most, at least, and for me personally, one of the more important things is to not change the present sight lines. Don't add to it. With the parking being as high as it is, and it's really tough to see precisely where that is, but it looks like it's closer to the perimeter. So the present hospital building, although very high, 75 feet, is really in the interior of the campus. And it's separated from the perimeter on most sides, okay, by a significant amount of space, mostly parking, but there are some maintenance buildings there that are closer to the perimeter, but they're very low. So in thinking about all of this, that was a thought that came to my mind and other people's minds, that if the height were to be similar to what's existing, then it should be pushed to the same point as where the height currently exists. See, what we have right now, if you move over again to Torrance and you have the Pace building and then the other RCFE buildings there, that is still, although it's not going to block a portion of the Flagler Lane, Flagler Alley, it's still going to impact on those people that are on Upper Tommel. And already, I've been told they're suffering with transients parking there with motorhomes and able to look down into their properties. So if the build out is actually,
sorry, Bruce, transients parking where?
on Flagler Lane, on the east side. They've been, and this isn't, this is a Torrance issue, but transients have motorhomes or cars, but particularly the motorhomes, they're larger ones. They're the Class C motorhomes. They're parking there and they're able then to kind of look over into those homeowners that live right there, right on, Upper Tomley to the west, right by the wall. So when you add on to then the projection of the RCFE that's coming very close to Flagler Lane, you're going to have that, but double the problem. So we're still going to have some people over on, certainly on Tomley, that will be impacted both by construction, air, pollution, noise, all of that.
Those would be things, again, that we'd want to,
oh, sure,
look at in the EIR, and one of the reasons why, hearing some of those comments that we removed you can see the construction of the 4 stories between the blue and the gray building that was in the previous drawings.
Right.
Was to address some of those impacts. And then also having Flagler closed there with no entrance at towers, I think would hopefully help things as well.
Well, since you're going on to there, let me, well, first of all, let me ask, and I think either Leslie, Ed, or others may know, is it FAR code 503? Anybody there? Okay,
Yes,
there's a section.
We're aware of that. Mm-hmm.
Okay, so if there's going to be an entrance there, you're going to have PACE and possibly the, the memory care or the RCFEs. You're going to have responders coming in and picking people up there. Now, from what I've heard from talking to Torrance, the Torrance responders are not really happy with completely closing the road. In other words, putting a complete barrier across. They want to be able to, they would want to have some kind of access there. Okay, so what's to stop the responders, the Redondo Beach EMT that are picking up the patients that need to go to the hospital in an emergency fashion from coming through the open barrier, coming down through the neighborhood and going to either Torrance Memorial or to Little Company of Mary, which is to the southeast of the campus? That's been a concern that I raised back in the initial study comments. So that's something you should think about.
Yep.
Okay.
Yeah, that would need to be looked at as part of the EIR. In my experience of being a city manager in cities, you would have a gate or something there that only fire would have access to. Would they use that? Again, that would be something that would need to be worked out in the EIR process.
Well, okay, let me ask you, would the EIR process be able to assure the residents of our neighborhood that Redondo Beach responders would not come through there?
Well, Ed, jump in, Ed. Yeah.
Yeah, Bruce, what the EIR process will focus on is the kind of impacts that you're talking about. So, the impacts of ambulances coming through your neighborhood at night are likely to be, noise impacts, of course, potentially traffic impacts, maybe safety impacts. So as you know, the EIR focuses on those kinds of issues and would identify the likelihood of noise impacts as a result of that. So we have a better understanding of what could be done or should be done to address those.
Right. Oh, I know that. But that is not an answer to my question, which is, would the EIR process mitigate completely this possibility? And of course, the answer is no. I know that.
No, the answer, of course, is that EIRs must address significant impacts, and they, by law, identify feasible measures to address those impacts. Now, if they're not feasible, then the EIR goes on to look at potential measures through an alternative.
Okay. So, but what I was asking, and you've answered it in a slightly different way, I would have to take the position, and I would say it this way: the EIR is a process that does not have the authority to dictate to any governmental entities in Redondo Beach.
That's correct. The EIR
it can merely recommend, and that's a big difference.
True,
okay.
But it also, remember, at the end of the EIR process, a decision-making body has to make a series of findings, right, that acknowledge the impacts, if they are significant, so that they recognize the impact of the project that they are being asked to approve, and they need to make a statement of overriding considerations. So it does kind of raise the bar higher. It gets what the public wants, which is accountability and disclosure. That's what CEQA does, and that's what our EIR can give you.
Sure. No, I know that. And then the next thing is the service entrance. You recall that in the past, Jeff was very concerned about having any service entrance over on Diamond. Now, could you address why having a service entrance on Flagler Lane is any different from what Jeff had objected to over on Diamond?
Well, in previous drawings, previous concepts, this is Tom, we were looking at not only service, but we were looking at vehicles coming in there for the Center for Health and Fitness. And so the only thing that would be happening now is service levels because of where they are at will be service vehicles because of where they are based on the grade there. Again, it would be our proposal to have the road closed, so this would not be any sort of through traffic. It would be simply service vehicles turning in there and exiting, and not going through, because we're recommending that the street be closed at Towers.
Right. Yes, but in having service, would the service vehicles only be coming through during business hours, or would they be coming through at all hours of the day and night?
Well, that would be something that would be addressed during any sort of conditional use permit process, as well as, again, that would be looked at during the EIR process.
Okay, but right now you can't.
Uncommon, Bruce. That's not uncommon to identify the specific impacts of those kinds of activities at a very fine grain, where you know what kinds of trucks are expected and their frequency, you know the hours, and that's something where an EIR can really identify the provisions that would limit those activities to a level below significance.
Okay, and then would there be access so that employees, if they decided they wanted to park in the neighborhood, in the Torrance neighborhood, would it be convenient for them to walk up and into the building?
Sorry, Bruce, say that again. You're asking what?
Okay, and let me stop and back up. One of the reasons for a lot of my questions is because right now we don't have any details. And I know, yes, it's going to come in the DEIR, okay, and then the EIR. But right now, what you've showed us is very high level information. And so a lot of these questions, you may think, well, why are you asking it now? That's because we have concerns, but we don't know what the answers are. Okay, and so just bear with us. I'm sure there are a lot of other people that are on the call who would ask similar questions. Okay, so what I'm saying is, one concern that we raised earlier when the exit entrance was proposed to be there on Flagler, and also that there were going to be stairs coming up at the Child Development Center, is that that was going to be a very convenient way for employees to enter and exit the building. Now, with 220 units, you're talking about 160 employees, maybe more than that. That's a lot of employees. Where would they be parking?
Right now, the parking structure is sized for residents, guests, and employees.
Okay, so the employees would be instructed only park there and not park into our neighborhood.
Correct. That's the capacity.
Okay.
That's planned, yeah.
No, that's great. That's good.
I mean, to the point of the stair, we would also still like to see a stair not as monumental as what was shown before, but as a convenient stair to connect the campus level with the Flagler level down at Barrow, so that both residents and the general public can connect that without going through a building. But that's not for convenience of parking in the neighborhood. That's really for, going shopping or going to the park or whatever. The parking would be accommodated on the site itself.
Okay. Okay, good. Thank you.
We have a few people who raised their hands too. Bruce, do you want to give them a chance and we'll come back to you?
No, that's fine. Sure.
How about we go to George and then we'll go to Rick after that.
Then, Kristen, we do have questions from Mark that are coming through on the chat. So.
Okay, great. I'll take a look. George, I'm so sorry, but we cannot hear you. Let me see. I'm going to unmute you. All right, George, try now. All right, we'll try to get that figured out. Let's go ahead and go to Rick.
Oh, can you hear me?
Yes.
Fantastic. I am calling on behalf of the condominium building across from the empty lot here on Burrell and Flaglers, to be specific. And currently 12 of our 18 units overlook the empty lots. I mean, the prior plan was for a child development center, plus the grand staircase, plus who knows what beyond that, I kind of forgot. But nothing to seriously impact our sight lines as it is compared to what we currently have. I've got to say that I echo some of the sentiments expressed by Bruce, that I would have preferred to have a larger footprint of the assisted living building, the ones in blue on your presentation slide, because with the higher, if you increase the footprint, you would have hopefully have decreased the amount of stories from 6, which is what you currently now have planned, to who knows what. But my concern is, one, sight lines from our 12 units. We're going to be overseeing the PACE building. Plus, beyond that, you have an elevated grade, and now we're going to have 6 stories of assisted living. So for us, the impact is huge, sightline wise. So I am unfortunately disappointed in that. The second item is, as expressed also by Bruce, is going to be the increased traffic to go in and out for the emergency vehicles, for the service vehicles, that kind of thing. So what I would hate is for noise to severely impact our residents here, especially at night. And especially with a building that's going to be that high, the assisted living building, when you factor in the noise closer to the street level, it has nowhere to go but away from that building, just from an acoustic standpoint. So that is also a disappointing aspect of this new revised plan. So I do want to share that. I wish the 6 stories was reduced to 4. I realize that you're pushing the building out towards the perimeter of the towards Flagler, and unfortunately, it does have an impact here on Pearl. Those are my comments.
Okay. Thanks, Rick. Looks like Dempsey's.
Yeah, if I may, and I'm going to be really brief because this is really the concerns of the neighborhood are what has brought us here to begin with, and I am not a neighbor, and I definitely commend this very large revisioning to try to meet some of the concerns of the neighbors, Tom and others, and everybody involved in the project. I also appreciate that I think the additions of the aquatics and the PACE program is to offer widespread public benefit in revising, and that's all considering the public benefit at the larger level. Unfortunately, Bruce is quite right, and Jeff and the last speaker, the constraints of having to keep the 514 building there, I guess, really has dictated an awful lot of this design, which does force some of this to the perimeters. And the perimeters are where we're blocking view and we're imposing some density on those neighbors. You can correct me if I'm wrong about that. I mean, there's no real solution for you because the 514 building pretty much has to stay put during phase 1. I'm guessing that if indeed you could start from scratch with this campus, you could vision this differently and meet some of these concerns and desires of the neighborhood. So I'm not offering any solutions here. I'm just hearing the neighbors and understanding that even though you've made really great efforts here, you're still presenting a real problem for the neighbors, both with height right on top of them rather than pushed more toward the center of the campus, and also some of these traffic concerns of service vehicles, et cetera. So I don't know if you want to speak to that in any way. I'm I'm so sorry that this is the situation, because as everybody knows, I've been a proponent and remain a proponent for what's desired here and for what we're trying to accomplish and to offer a healthy living campus. But these are some constraints that I can really sympathize with the neighbors, and I'm not sure we've solved their problems and maybe in some ways made them even worse. And that's all for now, but I'm looking forward to hearing from others.
Yeah, I would just add to that, Dincy. I think it goes back to the trade-offs that yes, we were trying to keep the 514 building there, but what was really pushing the design is the open space. And trying to keep the open space, you could go shorter, squatter, fatter buildings there, but then you're gonna eat into the open space. And so we tried to reach a balance there where we were able to maintain the open space. Yes, there is additional height. We've tried to reduce the traffic coming in off of Barrel and Flagler from what we saw in the 2019 plan, and that you don't have any of the Center for Health and Fitness vehicles coming in there. So that is part of the trade-off that we're trying to work on.
I have Jim Light, and then I will read a few questions from Mark, and then maybe go to Jeff. I know we usually keep this meeting to an hour, so we'll go to Jim and then read some questions from Mark, and then Jeff. Go ahead, Jim.
Okay, thank you, Tom. Appreciate you coming out and briefing us. You know, there's a lot of pluses and minuses here, and I appreciate that. I love that you've cut the development time in half into a reasonable period. I love the aquatic center. I like the size of it. And I like the reduced density of the Recife, you know, the assisted living portions. On the downside, I hate that parking lot tower. I have to tell you that. I think it's going to be an eyesore to the rest of the campus. And I'm a little disappointed that we fought to keep the health and fitness center opening up onto the green space. Now it's up a story. Before it was, you know, we started down below it. Now we're up above it. But hey, if it's athletes going there, I guess going down a flight of stairs or whatever isn't too big an impact. The one part I am concerned about is it seems like the whole balance of the facility is dependent on phase 2. If phase 2 doesn't get done, you lose the community center, you lose the pool, you lose the health and fitness center. So you actually go backwards because health and fitness center is there today. And so that's my one concern with this phasing, and that it becomes a very unbalanced project if phase 2 doesn't go through. And I would press the city to mandate if that if you're going to do phase 1, you have to commit to phase 2 just for that balance. I heard, you know, I'm empathetic with the neighborhood there, but I'll tell you, I live right down the street from Kensington. I'm on the main access route for the Kensington Memory Care Facility from the main route for the ambulances and fire department. And most of the time, they will roll down the street without turning on sirens just because of the noise impact on the residents, unless it's a truly critical thing and it's middle of the day with a lot of folks at the stop signs. But I think that's, that was one of the concerns of this community, and that was way overblown. We don't experience that, nor do we experience the impacts of the service trucks coming in. And the entrances are right off residential streets. They're not off of PCH. So we have not seen those things materialize. That's about half the size of the Recife units in here. So even at double, I don't think we'd see a lot. You could, the EIR will have mitigations that have to be, if you find a significant impact and you cite a mitigation, it's got to be done, or you can't build. But I would say the statement of overriding considerations is kind of a cop-out. That's when the city and the project owner pretty much say we can't do it without this, so kind of, live with it. So if it gets to that stage, you're just going to be impacted. So again, applaud the process. I kind of wish you could have stuck with the original design, just reduced and less phasing, more underground parking. But I understand you probably looked at that, and that drives the cost up substantially and renders the project infeasible. So my main dislike is that giant parking monolith. I do appreciate, though, that you put the narrow side towards the residences. So I do appreciate that. And the noise reflection, because of that, and the way the assisted living facility is facing, the reflection off that is minimized because all the long walls are interior to the project or out towards Barrel. So that's my comments, some pluses and minuses. Appreciate all the effort of this. I think you guys have gone above and beyond what any other developer I've seen do.
And that's for sure. I'll just jump onto Jim and say, you know, if this were any other developer, they wouldn't be as conscientious about this as you as a public entity and the public trust. And that certainly needs to be emphasized. So thank you for saying that, Jim. I meant to tag my comments by saying that.
Okay, why don't we go to Jeff, and then I'll read some of Mark's questions. I think some of them were answered for the parking structure, but I'll read them. And go ahead, Jeff.
Yeah, as much as I like open green spaces, I'm all for dropping the height of that parking structure and going into that green space. I personally don't see that as an area that's going to be heavily utilized. That's just my pessimistic look. I think that to reduce that parking structure, because that towers, you know, I mean, it's just going to be a big gray behemoth, and will take away from the architectural look of the other buildings. So if you can bring that down, that would be, for me, a plus.
Then I'll read some of Mark's comments that came to me. Not using Flagler will push future traffic onto Prospect.
You're having a repeat happening with your volume.
Dan, I'm going to forward to you.
All right. Okay. Am I doing the same thing?
Someone has two devices on at the same time.
Is everybody muted?
There, I think you're okay now, Dan.
All right. Number one, so not using Flagler will push all future traffic onto Prospect? Question mark. Number two, how for the construction period are you limiting impact on Prospect and Barrel per your slide? Shall I just read these? Does anyone want to address these?
Yeah, I mean, the first two are EIR questions that we'd be addressing as part of the EIR.
Okay. Number three, why is phase 2 stair step to maximize visual mass towards Barrel Heights? Why isn't it flipped 180 degrees? Number four, what fraction of the tenants are from the owners of BCHD, the beach cities? Number five, 9 years of build was 15 years. Does that mean 4 years of construction is 10 years?
Yeah, again, that's going to be, so maybe I'll just address a couple of those. So that's going to be looked at as part of the EIR. Again, we're looking at it for phase 2, it would be a 2-year construction. If the funding is available, it could happen right after phase 1 is complete, as Jim was talking about. And so again, if we're looking at 2 years of construction, if we don't start right after phase one, then it would be longer. I think the key difference is that we don't have the 510 building in the EIR anymore, and so it could be 4 years, or it could be 4 to 5, depending on when we start the second phase.
Okay. 6, what specifically is the height of phase 1 and phase 2 in feet? Does Paul have that?
So we have that from the elevations that we provided.
Yeah, so everyone that's listening on the call, we received feedback that it was hard to see on our PDF PowerPoint. We can only upload 16 megabytes and our PowerPoint was extremely large. So we'll be uploading those documents separately so you can zoom in on the PDF of these 3D and also the height, just so everyone's aware. That will also be going out to the community later today. I am going to put some labels just so people know for this for the community working group presentation, so people really know that this is the 2020 refined master plan versus some of the previous ones. I know all of you have been very close to the project, but I'm going to put a few titles, and I noticed people might get confused. I'll also update the timeline that we had a typo that still said spring 2020, which is going to be late 2020 for the EIR, draft EIR. So I'll make those updates, and that will go out. We'll send it to the community working group as well.
The last question on this email from Mark: why are there no street level renderings? There is no way to know what this looks like and how obstructive it is to the neighborhoods on the north and west. Unacceptable aesthetic impacts should not wait until the EIR unless you are deliberately burying them.
I think we've been real clear that we're not deliberately burying anything by our commitment to the public process of this project. So again, these are at the concept level here, and we want to move to more detailed impact analysis as part of the EIR.
Okay, and then he sent another email about heights and questions. The new parking ramp is 75 feet tall. That's extremely tall on the south side. Apparently the phase 2 buildings are also 75 feet. The numbers are illegible. I think Kristen just addressed that. You are asking for an approval to proceed with the DEIR using this plan. Also, why didn't BCHD do the EIR for 520? Why did they do it for this project? Why picking and choosing?
520 has a long-term lease, and so we don't have control over that building. We do own the land, but that lease is a long-term lease, so that's why it does not include 520 or 510 at this point, because they have long-term leases. What was the first part of the question?
It had to do with the phase 2 buildings and their height. And then there was also, why didn't BCHD do the EIR for 520, which you said, which you answered. And that's the end of the emailed questions.
Yeah, but Tom, I think one of the important things here in the EIR, it will, even though you're not changing those 2 buildings, when you're doing traffic analysis and noise analysis, it considers what stays currently, so it'll build upon the impacts that are there today. It doesn't ignore them.
Right, that's true. That'll be part of the EIR. That's exactly right.
So I know Jeff has his hand raised, and if anybody else would like to speak, I encourage you to speak up. And then we didn't see any emails come through to the communications@bchd.org. But I know we're heading on 2 hours right now. I see Ken raised his hand. If you want to raise your hand in the group, and Roseanne, so we'll give the CWG members a chance first. So why don't we go to Jeff and Roseanne?
Yeah, the drawings and whatever I got and I don't know if there were any other than that, were a downward view on the proposed phase 1 and phase 2. Again, there's no side view of heights or anything. And, you know, so there's no sense of scale for this for me. And from what Mr. Backley said, that, you know, everything will be addressed in the EIR, but can we not have BCHD put together some kind of a proposal? I mean, we don't know. I mean, I asked about the aquatic center, and Tom said, yeah, we can have a pool there, but are there any ideas right now? I mean, to go out to the public and say, oh, we're going to have a pool. What would you like? You know, I would think that the BCHD has an idea of what they think the community needs. And again, I understand that this primarily is centered around the residential care facility. This is the gem that, you know, you guys want to make revenue to continue providing service. That is going to, you know, even though it may only take, you know, 4 or 6 years to build, it's going to be around for a long, long time. And I'd like to get some ideas as to how long you think the longevity or the lifetime of this program will be. When will it not be necessary? A little bit more detail in terms of how many people you plan to put in there rather than the number of rooms. You know, it just seems, just based on this, it seems really vague. And is there going to be another community working group meeting before this gets turned into the EIR process, so that we can go over details and see what you know, see what Beach Cities Health District wants to do, a little bit more detail, and to flesh this out other than just having some architectural diagrams here. That's all. Thank you.
I was taking that more as comments from Jeff. I mean, if there's a specific question, be happy to answer it. But we hear you. And
well, I mean, you know, how many? You know, you've got this new plan. You've indicated that there's going to be a total of 220 units, and that includes the Silverado. Now, is that Silverado going to be Silverado, or is that going to be a Beach Cities Health District memory care unit?
no, it would be a part. We don't know if it would be Silverado, but it would be memory care. It would be either Silverado or another operator.
I see, but that would be independent from the residential care facility?
No, it would be part of it.
I see. So whoever's going to be running the memory care will also be running a residential care facility?
Not necessarily. It could be Silverado, could be in there with another partner, or it could be one partner doing both. As far as the number of people, Jeff, we're going to have that number for the board. If we don't have it, I don't know if Paul was able to get it today. But prior, the 2019 plan had how many people, Paul? And
I think it was up to 540, I think, 2019.
Right, and we're getting that. Do we have the numbers yet on?
We'll have it tomorrow.
Okay, so Jeff, we'll have those numbers, and we'll make that public. It's obviously going to be significantly less than 540.
Right. Right. Okay. Again, my concerns are traffic impact. I'm sorry?
Noise.
Yeah, and how many employees you plan on having there, their impact. You're going to be running 3 shifts, and you know, the amount of traffic that we're going to see for all the changeover on the shifts. you know, it's been a long time since the hospital has operated, and that was a 24/7 facility. And now we're going back to essentially a 24/7 facility again. You know, so that information I'd like to have, even if it's an estimation, just so we get an idea, rather than wait for it in an EIR. But bring that out to the public now and say, you know, this is kind of what we're looking at.
Yeah, again, traffic is exactly what EIRs are built for. We're going to have a hard time getting traffic numbers, you know, outside of an EIR process. I think your point about the pool is one that we can talk about. We would recommend let's move forward with the EIR process and let's work on exactly the details of what would be going into that 24,000 square feet. But as it relates to traffic and shifts and employees and all of that is prescribed as part of the EIR process.
Right, but once the EIR process is involved, it starts up, and they come up with something like that, it is then, the EIR is then approved by Beach Cities Health District, is it not?
It would be certified by the board of the health district.
That's correct, but at that point in time, once the EIR gets done, and all these facts that we don't have right now come out, you know, where's the public stand? I mean, they see it and they're going to say, well, wait a minute, that's not really the idea I thought we were going to have here. But by that time, it really is too late, isn't it? I mean,
Yeah, I disagree. I don't think it would be too late. And I think we've demonstrated our willingness to shift and listen and try to make this a better project. And so if there are findings in the draft EIR, again, there's going to be lots of input, lots of opportunities as prescribed by state law within the EIR as it relates to traffic impacts of a project that is assisted living versus the traffic impacts that we have today from a medical office park. So again, I know people want to know the answer. That's why we want to get into the EIR process, Jeff.
Right. But I mean, I believe that we would still be looking at the old blueprints, the proposal that you had before this, if it wasn't for the fact that quite a few people from Torrance came down and protested in front of the board about what this plan was. And with all that negative feeling from Torrance community, which isn't even part of Beach Cities Health District, that, you know, Beach Cities Health District did an about face on this thing and came up with this plan, which is significantly better than the old one. But, you know, don't you think the public should take a look at what you want to do first and then kick the can around, not just with the, working group here? I mean, I really had very little information to go on at the start of this meeting for me to really get an idea of what's going on, for me to put any input in. So I think we're still at that point in time.
So Jeff, if I could maybe add something to the discussion. The process, I think from here on, would have the district take two actions at some point. They would consider certifying the final EIR after it's gone through the public review process in response to comments. And then they would consider sending a project forward for approvals to the City of Redondo Beach and or Torrance. So those are two separate actions, and in between there is the potential to discuss permutations of the project that are alternatives or mutations or options that are informed by the EIR process. So what you just described was a process that is essentially uninformed. What you just described was a process where the site plan was refined in response to what you called negative feelings. And that can take us only so far. The next chapter in this process is to refine the site plan and other programmatic considerations based on an objective analysis of the impacts. And it's only the EIR that can do that work. And it will do the work based on a project that gets a little bit further fleshed out than what you're seeing tonight, but all of that detail will be disclosed in the project description. And then we'll be able to look at what the impacts really are. Like some of the things we've heard tonight are about impacts of visual intrusion, and some of the speakers called those impacts. Well, there will be effects possibly, but are they significant impacts? And to what degree? And what would have to be done to resolve those? We don't have answers to those questions now, and we would only have answers to those questions by doing a visual impacts analysis on a project, and whether the project we do that analysis on is the one that is ultimately approved, or if the analysis simply informs us as to what adjustments would be made to the project to avoid those impacts, we have advanced our project to something that's more suitable to the neighborhood and to the district. That's what CEQA does, and that's why I think that the recommendation should be to proceed. It would address those questions that everyone's asking in a more meaningful way. In my sense, I think we are sort of moving in half darkness now, and the board should not make a decision in half darkness. I think of one woman who stood up at one of our public scoping meetings. It was where we met in Manhattan Beach. And she stood up and she gave us a very detailed list of questions that were very well thought out. She wanted to know, what are the impacts on air quality? What are the impacts on noise? And she named constituents. She'd done her homework. She was making a real scoping comment. And this process owes that woman answers. We need to know what the project's impacts are. So does the board, so does the public. That's what the EIR will do for you. So I would suggest that we do kind of say, time's up, pencils down, let's move forward and get smarter about the impacts and the projects so that then the board and the community can make a more informed decision.
Ed, while you have the floor, can you please, Mark continues to ask the question about us being the lead agency. Can you explain that as far as a CEQA and why CEQA actually would suggest that we would be the lead agency?
Sure. Mark, do you have a copy of the CEQA guidelines? If you do, I would look at section 15051 sub A. Check that out. We've thought a lot about this question. Our CEQA attorney believes that we would be at risk of an illegal action if we didn't comply with what it says there. And I'll read you what it says. If the project will be carried out by a public agency, that agency shall be the lead agency, even if the project would be located within the jurisdiction of another public agency. So our CEQA attorneys believe that if we departed from that guidance in the CEQA guidelines, we would be at risk of preparing a document that is not legally defensible. We've shared that thought with the City of Redondo Beach and the City of Torrance, and we believe that's the correct decision.
Okay, so we're at 2 hours at this point, and are there more questions, Kristen?
How about Roseanne? I know she had her hand up, and then we'll take two. How about from the attendees, and then we'll call it a day if that's okay with everybody, because we're an hour over. That's okay?
Okay. May I go ahead then?
Yeah.
Can you hear me?
Yes.
Okay. So I'm glad that the number of units was reduced. That's really good. I'm glad that you have added PACE, because I think with COVID, a lot of us are looking at a different model for caring for elderly, and the smaller in homes or various smaller facilities where it's more like a home, where there's like 3 or 4 residents that are cared for in a meaningful kind of family style way is a really nice model. And I'm glad you're incorporating that. And I'm glad you reduced the number of units. And I would hope you don't feel as strongly that you have to provide care for all the elderly people that will need care in the future, that there are going to be other providers and other facilities. I'm looking at the phase 2 because that's closest to where I live on Diamond, and I live next door to Jeff. So I'm looking at that parking structure, and I had just a couple questions. How do people get in and out of that structure? Is it all off of Prospect like today? Is it
Yes.
2 entrances from Prospect?
Yes.
Okay. And then I'm a member of the Center of Health and Fitness. I really value it. It's the nicest thing for me just to walk next door and go to the center. And when you're saying we're going to do phase 1 and we might not do phase 2, while we're doing phase 1, we're going to have to relocate the Center for Health and Fitness because the building's unstable. You're not going to be able to maintain the building until you tear it down, or why is Center of Health and Fitness going away?
So the plan, Roseanne, would be to have the Center for Health and Fitness remain where it is while we do phase 1. That would be our goal, to try to do that for as long as we could. But then when the 514 building comes down, the Center for Health and Fitness would need to move off campus so that phase 2 could be built. And so the reason why the Center for Health and Fitness would need to be moved is to take that building down and address the seismic risk of that building.
Okay, I understand. And then the number of stories in the parking structure, you had said part of the reason for that is we need to accommodate people for the aquatic center. I personally would rather have a much smaller parking structure and no aquatic center if my vote were to count. I don't really need to have that aquatic center for my own self. I don't know how big of a demand that is for the community. It would probably be nice, but I don't know that it's worth having this whole project be upscale, all the extra requirements that would go along with having that. I'd like the Center for Health and Fitness and the Wellness Pavilion could benefit a lot of people. I'd like to see those. I don't really think the Aquatic Center is adding all that much, and it's going to cost a lot and cause an extra lot of traffic and parking and all of that. And I would like to, as just what others have said, if you could, you've revised this plan so many times to make it palatable for everyone, and you've improved upon it so much with this reduction of units, and it looks like it's much better and more acceptable. If you could refine it just some more in line with some of the things that people have mentioned before going through all the things that's required for the EIR. Instead of doing it the other way around, we're modifying it in response to the EIR, modify it ahead of the EIR so that people can really look at it, and the community has just seen this. It's just, you just put it out just the other day. So let us have our input once again. I know it's a lot to ask, but you've hung in with us and we've hung in with you this far. So I just ask that you give it just a little more consideration before going through the EIR.
Yeah, I just saw a similar question from Mark. We did have a meeting in March planned. That meeting is the day after tomorrow. So.
Okay, any other community working group members? We'll take two that have had their hands up from the public real quick, but anybody else from the community working group? Okay. Sheila, let's see. Can you hear us and go ahead and try to speak? All right.
Can you hear me?
Yes.
Great. Okay. Thank you so much. So I have 3 questions, and I think they're very quick. Will there be a no build option for presented to the public for the EIR?
You know, the EIR always includes a no project alternative, so yes.
Yes, there will be. Okay, great. In the architectural plan, of course, we haven't been able to see that. How will the buildings be architecturally integrated with the surrounding residential community? Is that a consideration? And I'll leave it with that second question.
It will be a consideration, yeah.
Okay, and then the last person, and remember we're going to present 2 days from now, June 17th, at the board of directors meeting at 6:30. You can also send your comments at communications@bchd.org. We hope you do. Please indicate if you want to have your comment read or have a verbal comment, and all that information is on bchd.org. And so we'll go with Ken. Go ahead, Ken.
Can you hear me?
Yes, Ken.
Can you hear me?
Yes.
Okay. Given a lot of the comments here, don't you think it behooves you to go back to step 0 and do a new notice of preparation and then have the public comment on your new plans? What we're looking at now is a straw man presentation. The details just aren't there, and various comments have been made which indicate they would like to see more detail before they make any kind of decision. And how are we supposed to respond to this EIR without having any of that information? Are you just gonna hit us with it when the draft EIR comes out? That doesn't seem fair, and that doesn't seem like it meets the spirit of what the NOP is supposed to do.
Ed, would you like to respond to that?
Yes, so speak to the NOP question. We've been thinking about this, of course, while the project was being refined, and wanted to be sure that the process is intact. The notice of preparation, the purpose of that whole scoping process, and you'll recall we had 5 scoping meetings, is to determine the scope of the EIR's analysis. So it's basically to identify the breadth of issues that would be addressed in the EIR. And thinking about the changes that the project has undergone, it's clear to us that that scope was big enough to begin with to address the changes that we have. This project is within the box, if you will, of the scope of analysis that we had defined through that scoping process. So there's no reason legally or practically to go back and start at 0 and begin the scoping process once again. But I also would add that, in fact, what's happened is the project has adjusted as a result of that scoping process. And in a way, that's exactly what should happen. It rarely happens to this extent in a CEQA process. But in a way, we've had the best of both worlds. We haven't started the EIR. We've had a scoping process. The project has adjusted. And as I was trying to state before, the adjustments that we've had now are about as far as we can get, I think, without having the additional information that objective analyses would provide. So I think we're at the point where the EIR is appropriate, and I think that the community should be asking and eager for that analysis to inform its view of the project, its understanding of it, and also to help its interaction with the decision makers when we have the public document available to all of us.
Well, Ed, can I just make one comment to that? During the NOP process, we were able to submit our comments about what we did, what we thought our issues were with the project. Now we aren't able to do that because we don't really know what the project is.
But I would argue that, in fact, what we received as input from the public was sufficient for us to define a scope of analysis. No, the purpose of the scoping process for the EIR is not for you to comment on the project. We made that clear at every presentation. It's not about whether you like the project or not. It's about what is the scope of the EIR, what issues do you think should be addressed, and based on the information we received from the public, we think that the scope that we arrived at is sufficient. We intend to do the same kinds of analyses on this project as we would have done in the previous version. It's going to be slightly adjusted because the project has adjusted. But in terms of the kinds of things we're hearing tonight, we've heard about sightline, which is what we call visual intrusion impacts. We've heard about traffic. We've heard about noise. We're going to address all those things. We planned to do it before. We will plan to do it again. But again, I have to remind you, the EIR and the public's input on the scoping process isn't really intended for you to redesign the project. It's intended to request that the EIR preparers address your environmental issues in its analysis. So I think that we're sufficiently ready to do that.
Yes, but we may have additional comments as a result of the change in plans, and we will not have the opportunity to present those to you.
You will as part of the EIR process.
After the draft is available.
Well, that's actually a very good time to do it. When the draft is available, we'll know more about what we're talking about.
But prior to the draft EIR coming out, you were supposed to address the issues brought out by the public.
No. During the process of doing the draft EIR,
yes, but without those comments from us, those won't be in the draft EIR.
I think that we're prepared to address the scope of impacts that were identified through the scoping process. If you think that there are other impacts or other issues that were not properly identified, then please let us know. But
okay,
our feeling is that
so we could submit information to you.
That's always been the case. Even though the public scoping process has been closed for months, what we've received in the interim is always considered part of the public record.
Okay, so at some point we will get some from BCHD, we will get some description of these plans, and we can submit comments on these that you will respond to in the draft EIR. That's what I'm hearing.
Well, Ken, you have these plans, and so what you're hearing is that if you would like us to, if you would like to make comments on what you're seeing here, what you've learned tonight, what you'll see more of on Wednesday, then you can go ahead and provide those comments to us.
What you show as a plan isn't really a plan to me. There's no artist renditions of what the buildings look like.
Right.
There's
details on
there's no details on anything. What the the construction schedule will be, what the how many loads of concrete you're going to do. All those things were defined in the NOP for the first iteration of this. They're no longer defined. So how
I would ask you to think about that in terms of the EIR and what analysis it does. The loads of concrete. Now, this EIR plans to address the impacts of the construction phases. The loads of concrete, if they go up or down, will still be part of that analysis. The scope doesn't change. It's the same scope. The project changes in details, and it may affect the outcome of the analysis. But the scope of the analysis that we plan to do is the same, essentially. Your comment doesn't really change our scope. You're not making a scoping comment at this moment.
Okay.
Can I have a question?
Sure. We're at 2.5 hours at this point. Oh, 2 hours and 15 minutes. Why don't we take one more question, and then again, I'll go ahead and summarize kind of what happens next.
Okay, I would like to know who at Torrance has given you permission to use Flagler Lane as your service and emergency entry and delivery entry and a lot of other things. Has Torrance given you permission? Because nothing, as I understand it, has been decided about how or where any blocking would be done on Flagler. So I would like to know who you have talked to at Torrance.
Tom, I'm happy to respond to that or give it a first cut.
Sure.
Torrance is a responsible agency, and part of their role is to make decisions after the EIR has been finalized. So they're waiting for the same analysis. They have not given permission. They have not denied permission. They have not addressed the issue. They have not made a decision, and they will not do so until the EIR has been finalized. They will rely on the certified EIR to make their decision. That's the law.
And I want to just let everybody know that you know, we appreciate everyone's comments and time tonight. I know our community working group usually lasts 1 hour, and just want to remind everybody that there is an opportunity on Wednesday, June 17th at our Board of Directors meetings, and we're very excited for you to please submit your comments to communications@bchd.org. You can also let us know if you'd like those comments read by our Dan Smith, or if you'd like to make a verbal comment. We'll do a similar process that we did today, but please submit that. That will help us get everybody in line. We hope the community working group joins that meeting as well and provides feedback to the board. I think we are always expecting feedback, so please, and I think we've shown that through our board meetings and these community working group meetings. Tom, do you have any last comments before we close out?
No, I'd like to thank everybody for their time and their input, and we are listening, and we're trying to make this a project that we're all comfortable with and meets the needs of the district, as well as is sensitive to any impacts to the neighborhood. And so we really do appreciate the input. Let's keep getting it. We have a finance committee meeting tomorrow night where we're going to be talking about the details of the finances a little bit more. So I know, Ken, you've had an interest in that. I hope you're there for that. And then Wednesday night, we'll present this to the board, and we'll see how they would like to proceed, if they'd like to take more time, or if they're ready to give us direction for our recommendation, either Wednesday night or in July. And so we appreciate everybody taking the time tonight, and let's keep working on this together. We really do appreciate your help.
Tom, it's Craig. A quick question. Can we get a copy of the PowerPoint?
Yes.
Yes, it's in your email. We sent it out earlier today, but we also, I'm just going to add a few titles to these slides so people are really clear about what we were talking about. You had the privilege of hearing us go through the slides, and I noticed some people might be confused, so I'm going to add that. And then it will also be under bchdcampus.org. All of our archives are there under the campus page, but we will email that out. We also plan to send a community e-newsletter out tonight with this presentation. So sorry, Dan, we just have to work a little bit longer to get that out. Any last quick admin things before we sign off? All right. Well,
All right,
thank you
everybody.
so much
Thank
for
you
your
for your
time.
time.
We hope to see you Wednesday.
everybody.
Okay, thanks.